My gosh, this one is so complex. There is nothing in the books about what to do with this patient. Go back to the anatomy. That's the place you start for everything. And what I am trying to bring into your consciousness today and tomorrow is this is what you do for the folks there is no book on. That there's no chapter in anybody's book on what to do. You've got to figure it out for yourself. There is no cookbook for this, okay? So you have to go back to anatomy. And like I said, how many people remember? Okay, like you barely passed the class, or maybe even you aced it because you were so good at mnemonics. But do you remember it now? No, we don't. You will today. Okay, I want you to think about the swallowing mechanism. So we're going to come up here. We're going to start there. The side view, lateral plane. And we're going to think about the swallow in terms of physics as a pressure valve system. I'm like, what the heck is that? We'll get into it. We're going to think about chambers, open places, and valves, doors that close or open those chambers. Okay? So the first chamber is the oral cavity. So that's your mouth. So we're going to start there. Now the next chamber will be the pharynx, or your throat. All right. So we have the mouth and the throat. What would be a valve or valving structure that could close off the mouth from the throat? Velum, yes, but that's more up here. Epiglottis would be down here. How do you, wait a minute. Everybody put some liquid in your mouth. And then tilt your head back with a mouthful of liquid. Dam it up with the back of your tongue. So base of tongue would be the valve there. Okay? So where that is, I want you to write base of tongue. B-O-T. All right? In what is red on here and clear on your page. It's base of tongue elevation. Remember hearing about that? And oh, he doesn't have good base of tongue elevation. Well, then we're going to have premature spillover, aren't we? Now the mylohyoid. Where's your mylo? Mandible. It's the mandible. So its action is to raise the hyoid elevation, and raise the floor of the mouth. Okay, we'll get into that. How in the world would that happen? I need, have I got it? Okay. Edith, can you help me with something? Its origin is the mandible, or the sides of the mandible. The insertion is the hyoid and the median raphe. Okay? So it is coming from the sides of the mandible into a ridge in the center. So what it looks like is Edith and I, you hold that end, the mandible's here. Okay? This center crease here is the median raphe. So it's down like this most of the time. But if we're going from here to here and pull back, let's both pull at the same time. That's what it does. All right, so down again, and then like that. You're like, well, how does that do hyoid elevation? Because the hyoid's right here, and it's connected down here to the hyoid. So when we're like this, everything's okay, now we pull. We just pulled the hyoid up too. Okay? That is the easiest way I have found to demonstrate mylohyoid. Thank you, ma'am. So, let's look at it here. What is the innervation? 5. A different cranial nerve. Which one is 5? Trigeminal. So we need green. Okay? So your mylohyoid is on here, right about there. It's another lift the flap deal. All right? We're going to only glue down the right hand side as you're looking at it, or Sally's left side, the patient's left side, or the right hand side as you're looking. Okay? It's perfect. Perfect. The reason we're doing this as a lift the flap is so that you can look under and see the geniohyoid.